What are the types of tumors? Benign and malignant. So, out of this, which is cancerous, which is non-cancerous? Malignant is cancerous. So, malignant is dangerous. It's cancerous as well as dangerous. So, when we talk about malignancy, it's quite obvious. When we talk about a tumor and when we compare a benign and a malignant tumor, obviously we are more concerned if a person has malignant tumor, malignancy, if the person has cancer. But that doesn't change the fact that sometimes benign tumors can be equally dangerous and can have ill effects on the host. Okay, so do not ignore benign lesions also, benign tumors also. So what determines the outcome of neoplasia? What determines the outcome of neoplasia? See, ekta tumor shorire ache that doesn't kill the patient. What kills the patient is the effects that the tumor has on the host. Whether it has metastasized, whether it has caused some local damage, or whether it produces some paraneoplastic syndromes, etc., etc. What are the outcomes of neoplasia, or what determines the outcome of neoplasia? So what does this picture suggest? What does this picture on the left hand side suggest? In between I have the brain, and circling the brain are various organs. So what does it indicate? Look into this picture and tell me, what does that first picture indicate? This one, hormonal effects, right? What does this picture indicate? Huh? This picture, this picture, this picture, this picture. Now tell me, this picture. Erosion and destruction. So the first one is local and hormonal effects. Second one is erosion and destruction. Chobi dekhachhi so that it becomes easier for you to understand. Now this coming to this picture. Now tell me. Cancer cachexia. And last one? Paraneoplastic syndrome, because it affects various organs. So people একটা topic কে কিন্তু সবসময় picture দিয়ে represent করতে হয়. So this is how you should remember. Okay. So what determines the outcome of neoplasia? Local and hormonal effects. Number 2, erosion and destruction. Local and hormonal alada korechi, but they are similar. Local and hormonal effects, erosion and destruction, cancer cachexia, and finally our topic for today, which is paraneoplastic syndrome. Okay, clear? Now, local and hormonal effects. As I said, both benign and malignant tumors are essential. When it comes to paraneoplastic syndrome, or when it comes to what determines the outcome of neoplasia, don't just fall for malignancy. You have to give equal priority to benign tumors. Why? When we talk about this, when we want to derive an answer for why, we need to know the location of a tumor. The location of a tumor. For example, a pituitary adenoma. A pituitary adenoma is benign or malignant. A 1 centimeter pituitary adenoma, which may be non-functional, which is benign, you can flat out ignore it. You can flat out ignore a pituitary adenoma which is so small, which is non-functional, but it can cause destruction of the normal surrounding pituitary gland, resulting in what? Hypopituitarism. Resulting in what? Hypopituitarism. Right. Here comes the importance of location. A pituitary adenoma, 1 centimeter in size, extremely small, you can flat out ignore it, which is non-functional, but you can think it's a benign lesion, so no problem. No, it can cause problem. It can cause problem. It can cause impingement on the adjacent pituitary, normal pituitary, totally destroy the gland and give rise to hypopituitarism. Second one, in endocrine gland. Whether a primary or a metastatic tumor to any endocrine gland can cause endocrine insufficiency. Can cause endocrine insufficiency. Right? For example, say a tumor in the pancreas. A tumor in the pancreas can cause destruction of the beta cells of islets of Langerhans, can cause destruction of the beta cells of islets of Langerhans. So no insulin secretion. Ki hote pare? Hyperglycemia hote pare. Right? Number 3, in case of gut, many tumors in the gut, they can cause obstruction. They can cause obstruction. For example, a colon carcinoma. A colon carcinoma can cause obstruction of the gut. Sometimes the affected segment can be telescoped downward, resulting in what? An intersusception. Intersusception porecho tomra? Anatomy te? Acha, you'll come to know when you study about surgery. I'm not explaining intersusception now. So it can pull the affected segment of the gut, resulting in intersusception, obstruction, intersusception, etc. Sometimes it can ulcerate. A tumor can ulcerate through the mucosa, giving rise to bleeding. Sometimes tumors can ulcerate through the mucosa, giving rise to bleeding, resulting in what? Resulting in what? Say a tumor in the colon can give rise to blood in the stool. That is called, what is the term used for blood in the stool? Melena. Have you heard of melena? Right. Then a tumor in the urinary bladder can result in what? Jodi melena hoye thake, there's a tumor of the a tumor of the colon, a tumor of the intestine can give rise to blood in the stool. So what can a tumor in the urinary bladder give rise to? Hematuria, very good. Blood in the urine, hematuria, very good. Okay. Then comes erosion and destruction. Egulo erosion and destruction, the one that I have just explained, erosion and destruction, which I have just explained. Expansile pressure on any natural surface. For example, in skin, the gut mucosa. This slide I have just explained, right? This slide I have just explained. Ulceration, secondary infection and bleeding. Melena, hematuria. Right? This slide has been explained. So while I was explaining local and hormonal effect, I have also explained the erosion and destruction. Number 3, cancer cachexia. So what's your concept on cancer cachexia? It's not a very big class. It's not a very big class. You just go through this. Ei jinishgulo porikhay khub ekta question they may not ask you, but paraneoplastic syndrome সম্পর্কে জিজ্ঞেস করতে পারে, okay? But you should know what is cancer cachexia. Cancer patient becomes thin, lean, emaciated. There is loss of fat, muscle wasting. The person becomes lean and thin, but basal metabolic rate is increased in such persons. Basal metabolic rate is increased in such persons in spite of the fact that there is loss of fat, body fat, and there is loss of weight, there is muscle wasting, right? Along with it, you get anorexia, you don't want to eat anything, you have anemia, and as well as systemic inflammation. Systemic inflammation. So what actually gives rise to cancer cachexia? What gives rise to cancer cachexia? Systemic cytokines. Have you heard of cytokines? Inflammation is over. So which cytokine is involved in cancer cachexia? Which cytokine is involved in cancer cachexia? TNF. TNF. Heard of it? TNF. Tumor necrosis factor. Tumor necrosis factor secreted by macrophages or tumor cells. Macrophages কেন আসবে? Why will macrophage come in? What is the role of macrophage in tumor? Our next question is to you because it's over. So let me ask you, what is the role of a macrophage in tumor? What has macrophage to do in macrophage ta ki? It's inflammatory cell, right? Which inflammation e ashe? Acute na chronic? Chronic. So আমাদের যখন tumor আসে না, the tumor is seen as a foreign substance. Our immune system gets activated and they try to kill the tumor cells. They try to kill the tumor cells. Initially, there will be acute inflammatory cells, which is followed by chronic inflammation. So chronic inflammation e ki ashe? Lymphocytes, macrophages are the key cells which are involved in chronic inflammation. So in macrophage gulo, they basically are recruited to the site of tumor, or they're basically recruited to the system only to fight the tumor cells. These macrophages fight the tumors. So the macrophage thekeo kintu ki ashe? These macrophages also secrete tumor necrosis factor. Okay. So what it does is it mobilizes fat. It mobilizes fat from the peripheral stores and it suppresses appetite. It suppresses appetite. So tumor necrosis factor er duto part ora play kore. One is, what are you saying? Ashmon. ঠিক বলছি না ভুল বলছি? হ্যাঁ, তাহলে খুলে আছিস কেন? বন্ধ করে এটা। So tumor necrosis factor, it mobilizes fat and suppresses appetite, giving rise to what? Loss of body fat and anorexia. Correct? Correct? Then there are other factors like interleukin 1, proteolysis inducing factor. Proteolysis inducing factor maneta ki? What is proteolysis inducing factor? Means protein lysis kore debe. Proteolysis means any agent which is involved in lysing the protein. Tar mane basically what happens is there is no protein formation. Loss of body fat along with loss of protein. No formation of protein, resulting in thin, lean, emaciated physical stature of a cancer patient, and this particular term is called cachexia. This particular term is called cachexia, right? There is reduced synthesis of protein and increased catabolism, which I have just explained. Then this cachexia hampers chemotherapy. If chemotherapeutic drugs are given, they somehow hamper the chemotherapeutic drugs. So this is about cancer cachexia. So the cancer cachexia, if someone asks you what is cancer cachexia, just explain this. There is loss of body fat, lean muscle mass because muscle wasting hocche, there is increased basal metabolic rate, weakness, anorexia, elevated BMR we just explained, and systemic inflammation. Inflammation obviously hobe je kono cancer patients e secondary inflammation hoy, thik ache? So these are the features of cancer cachexia. Now if somebody asks you what is the pathogenesis behind it, keno cancer cachexia hoy, একটা ভুল ধারণা আমাদের আছে যে tumor cells steal nutrition from the normal cells. No, that's wrong. Tumor cells, there is absolutely no evidence to suggest the fact the tumor cells steal nutrition from the normal cells. They don't do that. We don't have any evidence to prove that. Okay, so these are the reasons. One is secretion of various cytokines. Secretion of various cytokines like tumor necrosis factor, interleukins, okay, lipid mobilizing factor, proteolysis inhibiting factor. These are the ones which aids in cachexia. They suppress appetite and all. TNF suppresses appetite. It mobilizes lipid and suppresses appetite. So there is loss of body fat and what? There is anorexia. Clear? So now I'm going to the topic for today, which is paraneoplastic syndrome. Paraneoplastic syndrome. So what do you know of a paraneoplastic syndrome? Paraneoplastic syndrome occurs only in malignant tumor. Paraneoplastic syndrome does not occur in benign tumors. First and foremost thing is paraneoplastic syndrome occurs only in malignant neoplasms, not in benign neoplasms. Number two, they produce certain symptoms which cannot be explained by the anatomical location of the tumor. which cannot be explained by the anatomical location of the tumor. For example, a tumor in the ovary, look at this picture. ওখান থেকে দেখতে পাচ্ছ? A tumor in the ovary, ovarian carcinoma, দেখা যাচ্ছে না, I know, so come forward or else take the PPT later. Okay, ওখান থেকে দেখা যাচ্ছে না, কারণ এর বেশি আমি কিছু এক্সপ্লেন করব না. This is exactly what paraneoplastic syndrome is all about. Okay, I'll be coming to that, but if you look here, আমি একটা এক্সাম্পল দিচ্ছি. There's an ovarian carcinoma which is giving rise to hypoglycemia. Ovarian carcinoma giving rise to hypoglycemia. So this explains this particular line. Symptoms cannot be explained by anatomical location of the tumor. There is a tumor in the ovary, a cancer in the ovary, but it's giving rise to hypoglycemia. The patient has no abnormality in the pancreas. How is that possible? How is that possible? Or a tumor in the lung, small cell carcinoma of the lung, giving rise to Cushing syndrome. কি করে possible? So this is what I want to stress upon. Symptoms cannot be explained by anatomical location of the tumor or by elaboration of the hormone indigenous to the tissue of origin. Now I'm asking you, ovarian carcinoma giving rise to hypoglycemia. কি করে সম্ভব সেটা? Hypoglycemia কখন হতে পারে? Excessive secretion of insulin? তাহলে কি করে সম্ভব সেটা? This is what paraneoplastic syndrome is all about. They produce a substance which is similar to that of insulin, which has action similar to that of insulin. And this is known as ectopic hormone production. What is ectopic? Huh? Other than the origin. তার মানে insulin should be secreted from where? Pancreas, beta cells of islets of Langerhans. But instead of the beta cells of islets of Langerhans are absolutely normal. But the insulin-like substance is secreted by ovarian carcinoma. So there is a hormone production which is not from the point where it should be, but it's arising from somewhere else. It's coming from somewhere else. And that somewhere else is the ovary. Somewhere else is the ovary. So that is why it's called an ectopic hormone production. A small cell carcinoma of the lung giving rise to what? Cushing syndrome. So what does it produce? Tell me. What does it produce? It produces an ACTH-like substance. Right? So this is paraneoplastic syndrome. So it occurs only in malignant neoplasm, and symptoms cannot be explained by the anatomic location of the tumor or by elaboration of the hormone indigenous to the tissue of origin. It occurs in around 10 to 15% of the cases, affecting predominantly the middle-aged persons, and sometimes the clinical manifestations may be lethal. The clinical manifestations may be lethal. So if questions are asked, you just put them point-wise, 1, 2, 3, 4, 5, more than enough. In paraneoplastic syndrome, if you can remember these points, that is more than enough. So what is the importance of a paraneoplastic syndrome? What is the importance of the paraneoplastic syndrome? It may represent the earliest manifestation of an occult neoplasm. It may represent the earliest manifestation of an occult neoplasm. Right? Keno bollam kothata? What is the importance? What is the importance? Occult neoplasm, hidden neoplasm. Patient has hypoglycemia, দেখছো, patient এর প্রচুর hypoglycemia হচ্ছে, দেখছো insulin level খুব high, কিন্তু pancreas-এ তো কোনো problem নেই. There is no problem in the pancreas. You won't even think that the patient has an ovarian carcinoma. You don't know there's an ovarian carcinoma. Quite obvious. যদি hypoglycemia হয়, the first and foremost thing আমরা কি দেব? Patient কে আরো curbs দেব আমরা, right? Sugar দেব যাতে hypoglycemia-টা না করে যায়, আপনার hypoglycemia-টা exacerbate না করে. It doesn't exaggerate. Thinking that there's a problem in the pancreas. There is oversecretion of insulin. No. The oversecretion of insulin is not because of a pathology in the pancreas. The pathology is somewhere else. And where does the pathology lie? In the ovary. There is a carcinoma in the ovary, a malignancy in the ovary, which is giving rise, which is producing insulin-like substance, which is effect similar to that of insulin, resulting in lowering of the blood glucose level. And you don't know that. That's why it's an occult neoplasm, a hidden neoplasm. Occult means what? Hidden. Right, it's a hidden neoplasm. The neoplasm lies in the ovary. That is point number one. It may cause significant clinical problem and can be lethal too. This line does not need any explanation, and they mimic metastatic disease and confound treatment. These two lines are, they don't need any explanation. So the first line you must remember, it may represent the earliest manifestation of an occult neoplasm. How is it occult? I have explained it to you. It may cause clinical problems. Anything can cause a clinical problem. So that's not too much of a problem, and it may mimic a metastatic disease and confound treatment. This is the importance of paraneoplastic syndrome. What importance it assumes. So now, when we talk of paraneoplastic syndromes, we classify it. We classify it according to the system, and out of these two, the most important ones are the endocrinopathies. And in endocrinopathy, we'll be talking about the Cushing syndrome. That one, there are many. Slide ta dekhalei bujhte parbe, there are many. Then neuromuscular, dermatomyositis, myasthenia gravis-like syndrome. Dermatological means affecting the skin. Acanthosis nigricans is an example. Oglo details e ami jabo na, ami just tumor er naam gulo dekhiye debo. Osseous means affecting the bones and joints. Hematologic, associated with blood, and others. Okay. So remember the endocrinopathies. The endocrinopathies are very important. The endocrinopathies are very important. So we can classify them according to the system. Means endocrinopathies, neuromuscular, dermatologic, osseous, vascular, and others. So which organs are involved? Which organs are involved? You don't need to take picture. Take the slide. Ar boiye khub bhalo kore dewa ache. Just see Robbins. Just open Robbins. Ei je picture ta eita just kichuta mone rakhlei hobe. That's all. Nothing else is required. So which organs are affected? Lungs, pancreas, neural means nerves, breast, kidney, liver, ovary, soft tissue, thymus. So these are the organs which are predominantly involved. Lungs ta tar moddhe sobcheye beshi important. Lunge prochur cancer they cause paraneoplastic syndromes. That's why remember the lung. At least ar kichu mathaye na thakuk, lung ta mathaye thakteই hobe. Remember lung, small cell carcinoma, squamous cell carcinoma, egulo pore porano hobe. Okay. Now coming to the main thing, this is how you should actually classify, and if a question comes, if you write like this, that is more than sufficient. If you write like this, more than sufficient. Now you cannot remember each and every cancer. You cannot remember each and every cancer. It's humanly not possible to remember each and every, the entire thing. If you can remember, fair enough. But even if you can't remember, at least remember the important ones. যেগুলো important, সেগুলো তোমাদের মাথায় রাখতেই হবে. Okay. So the first one is Cushing syndrome. Cushing syndrome. Clinical syndromes, endocrinopathies. The first one is Cushing syndrome. Cushing syndrome is caused because of secretion of ACTH or ACTH-like substance. ACTH or ACTH-like substance. Huh? কোন টিউমার থেকে আসে? Adrenal gland. আচ্ছা এতক্ষণ বুঝতে পারিনি ব্যাপারটা। Adrenal gland, very good. আমি আসছি adrenal glands এ। কিন্তু we are talking of paraneoplastic syndrome. Adrenal gland has nothing to do here. Good. আমি ডিনাই করছি না, প্রথম ক্লাসে if you answer adrenal gland I am more than satisfied because you approaching correct, not I won't say it's correct, but you're trying at least. Adrenal gland has nothing to do here, nothing to do over here. So which tumors are involved? Small cell carcinoma of the lung. See this, pancreatic carcinoma means tumors of the pancreas, a carcinoma in the pancreas. Neural tumors, right? So কেন হচ্ছে? Because of secretion of ACTH or ACTH like substances. তো এবার বল কর্টিসল, তার মানে ACTH মানে কি হচ্ছে? কর্টিসল, অ্যাড্রিনাল গ্ল্যান্ড থেকে কর্টিসল আসছে। What is the precursor of cortisol? What is the precursor of cortisol? তোমাকে যদি explanation করতে হয়, what he just told me, for example, adrenal gland versus lung. Try to understand. You said adrenal gland থেকে, so adrenal gland থেকে কি আসবে? Cortisol. Cortisol. lung থেকেও যদি ACTH like substance একটা রিলিজ করে, if they release a ACTH like substance, ACTH or ACTH like substance, there will be cortisol. So now you may tell me, দুটো জায়গা থেকে তো cortisol আসছে, তাহলে কি হবে? তাহলে what's the difference? There is a difference. What is the precursor of cortisol? কর্টিসলের প্রিকারসর কি? হ্যাঁ, প্রোপিওমেলানোকর্টিন। So this is the precursor of cortisol is pro-opiomelanocortin. Now do a serum level, serum assay. Do a serum assay for cortisol and pro-opiomelanocortin. You will find here this pro-opiomelanocortin is negative to normal. Either it's negative, you won't find it. It's rather, you say it's absent. Whereas pro-opiomelanocortin level here is increased. Now it's clear? হয়নি clear, আমি জানি। It's not easy. আমাদেরই হতো না MD লেভেলে, তো ফার্স্ট দিন কি করে হবে? But you have to study. ঠিক আছে? So ও যেটা করলো, it's a very good guess. He did, cortisol level তো বাড়তে পারে, cortisol level বাড়লে এটা হতে পারে, correct? So we have to do an assay for cortisol as well as pro-opiomelanocortin. The precursor of cortisol is pro-opiomelanocortin. So when we do an assay, we will see pro-opiomelanocortin is absent in case of tumors from adrenal gland, versus when it comes to a tumor in the lung which is causing which is causing Cushing syndrome, the levels of pro-opiomelanocortin has increased. So this is the difference. Good guess. Very good. Next, remember hypercalcemia. What is hypercalcemia? এই দুটো মাথায় রাখো, Cushing syndrome and hypercalcemia. পারলে hypoglycemia, এই তিনটে পয়েন্ট মনে রাখতে হবে এন্ডোক্রাইনোপ্যাথিসে। হাইপোগ্লাইসেমিয়া আমি এক্ষুনি এক্সপ্লেন করেছি আগের স্লাইডে। তো হাইপারক্যালসেমিয়া কথাটার মানে কি? increased calcium level, blood is increased calcium level. তো হাইপারক্যালসেমিয়া কেন হতে পারে? কেন সেটা আমি জানি, ইনক্রিজ লেভেল অফ ক্যালসিয়াম, তো সেজন্য হাইপার বলছি আমি। Why? Bone Bone resorption, very good. Bone resorption কেন হতে পারে? প্যারাথাইরয়েড হরমোন, ভেরি গুড। প্যারাথাইরয়েড হরমোনটা কেন আসবে? তাহলে তো নর্মাল হয়ে গেল, সেটা। দেখো দুটো জিনিস হতে পারে, ওয়ান, either a tumor in the bone, which is primary to the bone, for example multiple myeloma, osteogenic sarcoma, etc. These are primary tumors in the bone versus tumors which has metastasized to the bones. There's a breast carcinoma, there's a prostatic adenocarcinoma, they have metastasized to the bone. They can all cause increase in calcium levels, hypercalcemia. Eta hote pare. That is one. Whether a tumor primary to the bone or secondary or metastatic to the bone can cause hypercalcemia versus humoral calcemic substances. This humoral calcemic substances is this, which you said, parathyroid hormone related protein, PTHRP. PTHRP is a humoral calcemic substances. Remember the first one, whether a tumor primary to the bone or metastatic to the bone do not fall in the category of paraneoplastic syndrome. A tumor which is primary to the bone or metastatic to the bone do not fall in the category of a paraneoplastic syndrome. We can tag the lesion as paraneoplastic syndrome only if there is a production of humoral calcemic substances, and the most important humoral calcemic substances is PTHRP, parathyroid hormone related protein. Right? And this PTHRP, unlike parathyroid hormone, normally parathyroid hormone kintu calcemia koratei pare, hypercalcemia, but this PTHRP, parathyroid hormone related protein, which is a substance which is very similar to parathyroid hormone, but in contrast to parathyroid hormone, this PTHRP is also secreted from normal cells, from various other cells like keratinocytes, lungs, bones, ovaries. Okay, so this PTHRP, so you get hypercalcemia, just I said lungs. So which tumor is most commonly involved? Squamous cell carcinoma of the lung, breast carcinoma, because এই জায়গাগুলো থেকে কিন্তু PTHRP normally secreted হয়. So parathyroid hormone বললে চলবে না, parathyroid hormone তো parathyroid gland থেকে আসে. That is not paraneoplastic syndrome. It must always be ectopic in origin. আর ectopic origin হচ্ছে বলেই we call it a paraneoplastic syndrome. PTHRP, parathyroid hormone related protein, is secreted from keratinocytes, breast, bones, ovary, and so the tumors which are implicated in hypercalcemia of malignancy, which is a paraneoplastic syndrome, are tumors of the breast carcinoma, carcinoma of the lung, predominantly the squamous cell carcinoma, onek rokomer carcinoma hoy, so squamous cell carcinoma, then you get renal carcinoma, adult T cell leukemia, lymphoma, etc. So just remember a few points, and this is because of secretion of, don't say PTH, it's PTHRP, parathyroid hormone. RP stands for related protein, PTHRP related protein, and other than that you have TGF alpha, interleukin 1, TNF, dihydroxy vitamin D. They are all involved in paraneoplastic syndrome, hypercalcemia of malignancy. Then you get hypoglycemia, which I just explained, ovarian carcinoma, fibrosarcoma, and other mesenchymal tumors, because they secrete insulin or insulin-like substances. At least remember these three, this is more than sufficient. Then you get syndrome of inappropriate antidiuretic hormone secretion, polycythemia, etc. So endocrinopathies are very important. At least you remember the endocrinopathies very well. Other than endocrinopathies, we get nerve and muscle syndromes. Nerve and muscle syndromes like cortical cerebellar degeneration, polymyositis, myasthenia gravis like syndrome. Not myasthenia gravis like syndrome. So the mechanism is immunologic. What kind of immunologic? Antigen-antibody reaction. Antigen-antibody reaction. Myasthenia gravis physiology te porecho. Ki hoy? Autoimmune disorder. Ki hocche sekhane? Neuromuscular kake? ওখানে অ্যান্টিজেন অ্যান্টিবডি রিঅ্যাকশন হচ্ছে, এখানেও সিমিলার রিঅ্যাকশন হচ্ছে, এখানেও কিন্তু সিমিলার রিঅ্যাকশন হচ্ছে। The neural antigens are targeted. The neural antigens are targeted. Instead of the tumor cell antigens, the neural antigens are targeted. Okay, so এখানে কি হচ্ছে? Where do you get all this? Bronchogenic carcinoma means carcinoma of the lung. Thymic neoplasms. So these are the ones which can give rise to myasthenia gravis like syndrome. Okay, so this is about nerve and muscle. Then dermatologic disorders. তুমি endocrinopathies যদি মনে রাখতে পারো, that is more than sufficient. বাকিগুলো just একটু spice up করার জন্য, but each and everything can be remembered. It's humanly not possible, I'm telling you. Nobody can remember. Dermatologic disorders, acanthosis nigricans. Acanthosis nigricans. Acanthosis nigricans কি সেটা আমি এখন এক্সপ্লেন করছি না। You get various hyperkeratotic verrucous patches, velvety-like appearance over the skin. That is acanthosis nigricans. This is not a dermatology class. I'm not explaining that. So কোন কার্সিনোমাতে পাওয়া যায়? Gastric carcinoma, lung carcinoma, uterine carcinoma. And this is because of secretion of epidermal growth factor and sometimes immunologic in reaction. Sometimes immunologic in reaction. So remember the names at least. Acanthosis nigricans is because of gastric carcinoma, lung carcinoma and some uterine carcinoma. ঠিক আছে? And the mechanism is immunologic and sometimes secretion of epidermal growth factor. Okay. Then comes osseous articular and soft tissue changes. Osseous articular and soft tissue changes. Hypertrophic osteoarthropathy. Hypertrophic osteoarthropathy. Hypertrophic osteoarthropathy তে কি হয়? ক্লাবিং পরে আসছে। New bone formation. Periosteal new bone formation at the ends of the long bones, metacarpals, metatarsals and phalanges এর এন্ড গুলোতে কি হচ্ছে? There is formation of new bone, arthritis of the joints, etc., etc. These are all features. Clubbing of the fingers. Now, প্রথম দুটো পয়েন্ট বললাম, periosteal new bone formation and arthritis of the adjacent joints. These are only seen in malignant neoplasms. But clubbing of the fingers, as she said, clubbing of the fingers কিন্তু সবসময় malignant neoplasm এ হয় না, benign conditions এও হতে পারে. So what are the conditions which can give rise to clubbing of neoplasm? Pulmonary edema. Lungs is correct. Bronchiectasis এ হয়. Some liver disease এ হয়. Cyanotic heart disease এ হয়. So these are the non-neoplastic conditions where clubbing of the fingers can also happen. So কি ক্যান্সারে হতে পারে? Again bronchogenic carcinoma. That's why I told you, remember lungs প্রায় সব paraneoplastic syndrome এ involved. ওর কোন সেল টাইপ ইনভলভড হবে বলা is difficult, predominantly small cell and squamous cell, but still at least if you remember bronchogenic carcinoma, at least remember lung আর tumor, lung থেকে কোন tumor arise করছে? Bronchogenic carcinoma. So bronchogenic carcinomas are by far way ahead of the rest when it comes to paraneoplastic syndromes. Correct? Then vascular and hematologic changes. Vascular and hematologic changes. Migratory thrombophlebitis. নাম শুনেছো? Truchot syndrome. Migratory thrombophlebitis is seen in কোথায় কোথায়? Various deep seated cancers, for example pancreatic carcinoma, again bronchogenic carcinoma, again the lung is involved, এই সব জায়গাতে আছে, এই দুটো মনে রাখতে হবে, in pancreatic bronchogenic carcinoma and pancreatic carcinoma. Okay, কি করাচ্ছে? Certain tumor factors are secreted, tumor products which activate clotting, then DIC, disseminated intravascular coagulation, শুনেছো? Heard the term disseminated intravascular coagulation? Again ওই clotting হচ্ছে, tumor factors secrete, tumor factors activate clotting. কোথায় হচ্ছে? কোন কোন কার্সিনোমাতে হচ্ছে? এইখানে মনে রাখতে হবে, একটা লিউকেমিয়াতে হচ্ছে, অ্যাকিউট প্রোমাইলোসাইটিক লিউকেমিয়া, অ্যাকিউট প্রোমাইলোসাইটিক লিউকেমিয়াতে কিন্তু ডিআইসি হচ্ছে, বিকজ ইট সিক্রিটস সাবস্টেন্সেস হুইচ অ্যাক্টিভেটস ক্লটিং। দেন নন ব্যাকটেরিয়াল থ্রম্বোটিক এন্ডোকার্ডাইটিস, হার্ট ভ্যালভসের মধ্যে স্মল ভেজিটেশনস পাওয়া যায়, হার্ট ভ্যালভসের মধ্যে স্মল ব্র্যান্ড নন ব্যাকটেরিয়াল ভেজিটেশনস পাওয়া যায় at the closure of the leaflets. Then again they are associated with various forms of cancer. So এই জিনিসটা যদি মাথায় রাখতে পারেন, at least endocrinopathies এর মধ্যে Cushing syndrome, hypercalcemia, hypoglycemia, then comes nerve and muscle syndrome, তারপরে কি আসছে? dermatologic মানে skin, then you get osseous, articular and soft tissue changes, তারপরে hematologic changes. If you can remember at least point wise যদি কয়েকটা মনে রাখতে পারো, you have earned more than enough to get handsome marks if you get a question on paraneoplastic syndrome. Clear? So this finishes the topic. Cancer cachexia মাথায় রাখতে হবে, paraneoplastic syndrome, cancer cachexia is very important. Question জিজ্ঞেস করতেও পারে, নাও পারে, but paraneoplastic syndrome definitely can be asked.